Hi everyone, welcome back to the channel. If you're here after watching part 1 of this series, you already know how to administer anesthesia in the maxilla. Today we'll focus on the mandible, which presents unique challenges due to its dense bone structure. We'll cover the key nerve blocks, landmarks, and advanced techniques to achieve effective anesthesia. Let's dive in. The mandible is different from the maxilla because of its thick cortical bone. This makes infiltration anesthesia less effective, so we often rely on nerve blocks. The main nerves to target are the inferior alveolar nerve, the long buccal nerve, and the mental nerve. Let's break down how to locate and anesthetize these effectively. First, let's discuss the Inferior Alveolar Nerve Block, or IANB. This is the most commonly used block for the mandible. Inferior Alveolar Nerve Block, IANB. Purpose: anesthetizes all teeth on one side, the lower lip and part of the tongue. Where to inject: near the mandibular foramen inside the pterygomandibular space. Landmark: palpate the coronoid notch. Insert the needle 6 to 10 millimeters above the occlusal plane, medial to the internal oblique ridge and lateral to the pterygomandibular raphe. B. Long buccal nerve block. Purpose: targets the buccal soft tissues of the molars. Where to inject: into the mucosa distal and buccal to the last mandibular molar. Landmark: the retromolar pad or buccal shelf. For the anterior teeth, we focus on the mental nerve block and the incisive nerve block. A. Mental nerve block. Purpose: anesthetizes the buccal soft tissues of the lower lip and chin. Where to inject: near the mental foramen, between the first and second premolars. B. Incisive nerve block. Purpose: similar to the mental block but includes pulpal anesthesia for the anterior teeth. Where to inject: same as the mental nerve block, but apply pressure to diffuse anesthetic into the incisive canal. For more complex cases, we have advanced techniques like the Gow-Gates block and the Akinosi-Vazirani technique. A. Gow-Gates block. Purpose: anesthetizes the entire mandibular division, V3. Where to inject: near the lateral side of the condylar neck. Landmark: align the needle with the tragus of the ear and the corner of the mouth. B. Akinosi-Vazirani technique. Purpose: ideal for patients with limited mouth opening. Where to inject: into the pterygomandibular space, parallel to the maxillary occlusal plane. Here are some quick tips for working on the mandible. 1. Always palpate landmarks like the coronoid notch and mental foramen. 2. Use aspiration to avoid injecting into blood vessels. 3. Be patient and inject slowly for better diffusion and less discomfort. And that's everything you need to know about administering local anesthesia in the mandible. If you missed part 1, make sure to check it out to learn about the maxilla. If this video was helpful, please like, comment, and subscribe for more dental tutorials. Thanks.